Dr. Bonine, what are dental implants?
Well, dental implants are threaded titanium posts. This is an actual implant. The green there is a delivery tool. We use these for replacing single teeth. We use these for replacing segments of missing teeth, if not the entire mouth. And we use them to anchor or stabilize dentures.
What will happen if I don't replace these missing teeth?
Not replacing these teeth, and I think if we were to look at your mouth, you're missing a number of teeth. And in reality, you only have 3, 4, 5, 6 teeth carrying all of your bite forces. No one has turned down your bite forces. You're still biting and chewing with the same force. You're still clenching with the same force. And having 6 pairs of teeth out of 14 is really like having only 42%, or like having only 6 joists left out of a 14 joist deck. You're going to beat the daylights out of them. You also will have a continued inability to eat nutritional foods. Typically when we lose a lot of teeth, we lose our fiber, our vitamin, and our fats and carbs take over. That having been said, there's a statistic out there that it's a 4% reduction in your mortality at any given age per tooth. And you can see, I don't like those numbers. It's unstable. These guys are going to shift and drift. And you've got gaps, and you so deserve to smile. So I really think it would make sense to make some type of replacement.
Is this going to be painful?
You've lost a lot of teeth, and if you think about having an extraction, and if I think of an extraction, I'd call it a 10. Your ears are pierced, or piercing your jaw. I think of an implant as about a 5, typically much easier than having a tooth taken out.
How long will this process take?
Well, the actual placement of implants is a few minutes, but on an individual case basis it could be as short as an hour, and in large cases a couple hours, or even spread out over time if it's a staged case. To completion is typically within several months. All that time in your recovery though, some form of temporization is there so that you can still go out in public and be able to eat.
Do implants have the natural look and feel of regular teeth?
In some cases, they even fool me, and I have to take an X-ray or radiograph to make certain that it is the implant, that I can't tell sometimes. And to even quote my mother, who had 5 implants at age 89, at 92, she says, you know, I talk, eat, and sleep 2 out of 3 of those. I need my teeth, and I wouldn't know they weren't my own if I didn't remember you putting them in.
After I have my first implants put in and I get ready to leave here, I don't want anybody to see me. Is that okay?
You asked about being able to leave and have a sense of privacy, and that's really very important to us. And maybe I'll show you on the way out, but we actually have a wing wall to give you a lot of privacy, and then your ride will pull right up about 5 feet in front of that so that the assistant can make sure it's an all clear, and we'll get you into the car.
Are they expensive?
I think it's a great investment, and the reason for that is their longevity. An implant has an 85% chance of lasting you 25 years. We have to think what that means. This is like sidewalks, headstones, stickly furniture, and we compare this to some of the other costs, say, of doing alternatives. You put in a 3-unit bridge, we're typically less expensive than a bridge, and far better investment over time because of that longevity, and because that bridge would have to be done over and over compared to a partial denture. The partial denture may be less expensive in the short term, but that's even got a higher turnover rate and typically damages other teeth. So in the long run, the implant becomes the best investment there as well.
Will my insurance cover implants?
Today, it's very difficult to predict any insurance company. Our experience is that some might cover a portion, some might cover the restoration that's going on top of that. These are all individual questions that we'll work to help you get good answers for.
Am I healthy enough for implants?
I think so. If you can handle having a tooth removed, it's typically easier to put an implant in, so I would say the answer is yes.
Am I too old for implants?
Oh, I don't think so. If you're capable of having a tooth removed, you're probably capable of having an implant. And as an example, I put 5 in on my 89-year-old mother. I had a 96-year-old woman who had 10, and she was a lot younger acting than some of the 80-year-olds I've worked on. And at last, a 101-year-old woman came in and had 2, so that her denture could be secured and that she would be able to eat. No, you're not too old.
That's good.